Just want to take a little bit of your time this evening talking about healthcare reform. What I wanted to try to do is give you a quick overview of the Maryland market, where we are today, how we got here, talk about the Patient Protection and Affordable Care Act, healthcare reform, what changes that what that means to us, both as individuals as well as business owners, and then kind of bring it full circle and then let you know about the future of healthcare in Maryland. What changes are taking place, the health insurance exchanges and so forth will be available up and operational this fall. Maryland health insurance market can pretty much be divided into four categories. So I kind of get a feel, I know we've got some HR folks and have some people with varying backgrounds. For those of you who are business owners and are purchasing health insurance, are you purchasing health insurance in the small group market? Show of hands, anyone? One or two. Individual market? Something else? Okay. All right. So the Maryland market can pretty much be segregated into four parts. We've got the large group market, which is 51 or more enrolled employees. We have the small group market, which is 50 eligible employees. We still have a thriving individual market, as well as the Maryland Health Insurance Plan, or MHIP. That's our state risk pool. Small group reform. Back in 1993, the state legislature passed a law that put in place small group reform. And Maryland, you'll find, is very progressive when it comes to the regulation of group health insurance plans. So this took effect in July of 1994. Basically gave us a scenario where we've got no underwriting, no pre-existing condition clauses, community-based rating, and we've got a set of state-mandated benefits, things that must be included in that health insurance plan. Kind of sounds like healthcare reform on the national level. So a lot of what you're going to find in healthcare reform is the rest of the nation catching up to us. So if you're a small employer, you've got 2 to 50 employees in Maryland, it's pretty much going to be business as usual. There are going to be some other opportunities for you beginning next year that we're going to talk about, but you're going to find that you're really not going to be negatively impacted by healthcare reform. Of course, we still have the individual markets. Still subject to medical underwriting in Maryland, so you do have to answer a whole host of medical questions. You can still be denied for coverage. You can be rated. You can still be faced with pre-existing condition exclusions. The pricing is competitive. Again, you've got to qualify for it medically, but it may be a less expensive alternative to the group health plan. And then we have the Maryland Health Insurance Plan, or MHIP. That's our state risk pool. So if you make application in the individual market and you get denied, you can take that declination letter to the Maryland Health Insurance Plan and you can get coverage with no questions asked. So this is something else the state of Maryland has done to address the accessibility issue. Now, I didn't mention it was affordable, but Maryland has taken steps to address accessibility. So really any Marylander who wants health insurance can obtain it. They may have to jump through a series of hoops, but that's already in place. Healthcare reform. Going through this next section on healthcare reform, a lot of these regulations are just now being drafted or being rewritten. So a lot of this is what's required as of March 11th. We had this meeting in December. Some of this could be a little different, but this is what we're going to be expected to do as of today. Obamacare, the good, the bad, and the ugly. What I've done is kind of divided this out into a couple of sections as to what impact healthcare reform has on all of us as individuals, what implications it has to us as business owners, and then also divided it out into a couple different sections here. So as far as individuals are concerned, there are some good things that came out of this. If you've got children on your plan, you can actually keep them on up until the age of 26, regardless of student status, regardless of marital status. In fact, they can be married and out on their own. If they don't have access to another health insurance plan, they're an eligible dependent on your health insurance. You got rid of lifetime limits. So everything's got an unlimited lifetime maximum now. Got rid of annual dollar limits on certain essential benefits. We got preventive care covered in full. So physical exams, well-woman visits, your annual screenings, mammograms, well-child checkups, all covered 100%. No copay, no deductible, etc. Also, working to get rid of pre-existing condition exclusions. For children, those under the age of 19, that took effect in 2010. For adults, it happens next year. The bad. These are things that are just, for lack of a better term, kind of nuisance items. For individuals, pretty much it's all related to taxes. Beginning this year, we see a lot of tax changes that we're going to go through here. But for those of you who may have been able to itemize your healthcare expenses on your 1040, the threshold right now, you can only deduct expenses that exceed 7.5% of your adjusted gross income. For the 2013 tax year, so when you do your taxes next April, that threshold is 10%. So what we're going to find is fewer people are going to be able to take the deduction, and the deductions are going to be smaller. Also, healthcare flexible spending accounts. Through your employer, if you participate and you're able to put money aside on a pre-tax basis to cover medically related expenses, you'll find that was capped at $2,500 this year. So it used to be the employer got to determine what that limit was, and then you were up around $5,000. And then finally, there were restrictions placed on flexible spending and health savings accounts back in 2011 that restricted your ability to purchase over-the-counter medications with those pre-tax dollars. You can still do it, but you got to go to your doctor and get a prescription for your Advil or what have you. Most aren't going to go through the hassle, so again, it's just kind of a way to collect a couple extra tax dollars. Now we've got the ugly. Again, on the individuals, 2 of them are tax-related that take effect this year. An increase in the Medicare tax of 90 basis points that affects some taxpayers, and also a Medicare tax of 3.8% on unearned income. Now, those top 2, they only affect taxpayers who have if they're filing single, if they have an adjusted gross income of $200,000 or more, those taxes apply. Or if they file a joint return with their spouse and their adjusted gross income exceeds $250,000, again, we'd be subject to that tax. We've got the individual mandate, which we'll talk about momentarily. And then we've got a set of taxes set to take effect in 2018 on what the government's calling Cadillac taxes. Basically, they're looking to tax high-value claims. Now, right now, when this was written, the government, was equating high premium to a rich benefit plan. But for those of you who have been purchasing health insurance in the Maryland small group market, everything's based on the average age. So you can have an average age in your 50s, and maybe not necessarily a really rich benefit plan, but you're paying a lot of premium. You can have a group with an average age in the low 30s, may have a nicer plan of health insurance benefits because they've got a lower age, you've got a lower premium. So you can find that the older group gets taxed and the younger one doesn't. So, the government's working on that at this point. Tax on unearned income. Again, it affects those earning over $200,000 a year as an individual, $250,000 if you're filing a joint return. And those are the threshold amounts. So what we're finding is that the tax on unearned income is 3.8%.
A question about what does unearned income?
It could be gains, it could be rents, it could be just money that you're not earning from employment. So what we're finding, if you sell an asset, you sell a piece of property, you sell stock, this is the tax that a lot of people are talking about. Again, it's only affecting certain taxpayers, but the tax could be at that 3.8%. It's actually on the lesser of the amount of the gain or the amount by which your income exceeds the threshold. An example, let's say we've got a husband and wife, their adjusted gross income is $350,000, so I can do the math. So you're $100,000 over that threshold, the most you're going to pay in tax is 3.8% of $100,000 or $3,800. So if you have a gain and it's $10,000, you're going to pay $380. If you sold a piece of real estate and you've got a $200,000 gain, you're still only paying tax on that $100,000 at 3.8%. But this is, you hear a lot about this. Oh, there's tax if you sell your house, or there's a tax if you sell investment properties, things of that nature. That's exactly what they're referring to. So, individual mandate. This is another controversial part of healthcare reform. It requires most individuals to go out and secure health insurance in 2014. And if you can't demonstrate that you have coverage that meets the minimum essential coverage requirement, you're subject to a tax. Actually, they are calling this a shared responsibility payment. So it's really not even a tax, it's a shared responsibility payment. It starts next year at the greater of $95 per adult for 1% of income. So when you think about it, if we've got some 20-somethings that don't have coverage and they're obligated, they don't receive coverage through their employer, they're obligated to go out and purchase insurance, they may be faced with a scenario of, okay, I pay a couple $100 a month for health insurance, or maybe they're earning $35,000 a year, they're going to pay $350 as a tax. Most of them are going to pay the $350 and keep going. But we are going to find those taxes are going to increase over the next couple of years. As far as effects on business owners, some of the good things coming out of this. Tax credits for small employers. So there are some criteria here. You've got to have fewer than 25 employees, and the average wage of those employees must be $50,000 or less. Now, when doing the calculation, you remove the owners of the company, as well as their family members, when you're making this calculation. So you're really just looking at the rank and file employees and what their average wages are. There is a mandatory employer contribution. So the employer must be contributing 50% of the premium. So if the employer's got fewer than 25 employees, fewer than 50,000, they're contributing half the premium, they qualify for the credit. The credit can be, this year, can be as high as 35% of that employer contribution to the cost of the plan. Next year, it goes to 50% of what the employer contributes to the cost of the plan. So they're expanding these. So if you qualify, or you're on the edge of qualifying, it's worth looking into, especially in 2014, where if you can get half of the money you're putting up for your employees' health insurance back in the form of tax credit, that may be worthwhile. Where this credit is optimized is if you have 10 employees and the average wage is $25,000, that's when you're going to get the greatest credit. And there are phase-outs as your company grows beyond 10 employees and gets closer to 25. There are also phase-outs as income grows between 25,000 and 50,000. So if you're at the top end of that spectrum and you've got 22, 23 employees and the average annual wage is somewhere around 45,000, you'll probably find you're going to pay your accountant more money to prepare that form than you're going to get in the form of tax credit. So, but there are calculators out there to help calculate that potential tax credit. And like I said, the expansion next year is going to be helpful as well. Actually, thanks. Medical loss ratio reporting. This is probably one of the better things that come out of healthcare reform. It took effect last year. And what it does, it forces all of the insurance carriers to disclose their medical loss ratios to the government. So for example, in the small group market, Care First, United Healthcare, Aetna, all of them have to demonstrate to the federal government that for every dollar they took in premium, that they paid out 80 cents of that dollar in claims. giving them 20 cents to cover their overhead, their administrative costs, and their profit. And if they can't demonstrate they've met this new standard, they're obligated to make refunds to all their policyholders. So, while I'm not big on the government telling business what they should do, this is a great consumer protection measure just because it's holding the insurance carriers accountable for the premiums they charge. So again, I think this is one of the better things to come out. It also applies in the individual market, but since small group and open insurance tends to be more volatile in its pricing, I threw it in here. Finally, I just kind of threw this on there. Any of you receive any money assistance from the government to cover your early retirees? I knew you wouldn't, because this was $5 billion that was thrown in the law to help union plans, government entities, or municipalities, and large corporations to help offset the cost of early retiree health care. None of us saw that. Okay, with that, again, these are administrative type headaches. W-2 reporting. If you provide group health insurance benefits for your employees, if you prepared more than 250 W-2s, this became effective for you last year. For everyone else, it's this year. On block 12 of that W-2, next January when you're preparing them, block 12, the code is DD, you have to report the total premium paid on behalf of that employee. So if you have a lot of turnover, that's something you probably want to track throughout the year and kind of accrue them, and maybe even accrue them through your payroll system. But it's really the government beginning to gather information on what these plans cost. Because remember that set of taxes that's set to take effect in 2018, this is the government starting to gather information on what these things actually cost. Summary of benefits and coverage. Again, for those of you who sponsor group health plans, especially if you've got employees, there's a new requirement that you distribute a new and improved summary of benefits. Now, a lot of these summaries of benefits, Care First, for example, to pick on them, they put one out that for the medical plan, it's one page front and back. The prescription drug plan is another page, just 3 sheets, that's it. The government got involved, and in making improvements through healthcare reform, they turned this into about 8 pages. Why? Because they want these things to read like a food label. They want you to be able to hold your plan up next to your spouse's plan and make a good informed decision on which is right for your family. So now that it's a lot more complex, there's a set of rules that whenever you have a new hire, someone coming into the plan, or you have open enrollment, you've got to distribute these to your employees on a timely basis or you can be faced with fines. And the fines are fairly stiff. So if you're sponsoring a plan, you've got employees on that plan, just make certain you're giving these out on a timely basis. Notice the health benefit exchanges. This is on hold till this summer. They were actually due by March 1st, but if you sponsor a plan, you have the obligation to tell your employees about the Maryland Health Insurance Exchange. It's going to be coming online this fall. Again, you're also going to be responsible to have provide minimum essential benefits. That is if you sponsor a plan. And if you sponsor a plan, you've got a 90-day maximum waiting period for new hires. Then we've got the other one. It's one of the other big things that you've heard about healthcare reform. That's the player pay penalty. This only applies if you have 50 or more full-time equivalent employees, FTEs. So if you're under 50, and we're going to talk about that momentarily, but if you're under 50, again, it's business as usual. This doesn't apply. But the full-time equivalents, where this is relevant, let's say you're in a restaurant, or you're in a retail store, where you've got a couple of businesses because aggregation rules apply. Let's say maybe you only have 15 full-time employees, but you got 50 or 60 part-timers. They're going to add the hours of all those part-timers together, divide by 2,080 to determine whether these rules apply. So some employers can get tripped up in this, especially those who have multiple businesses, because you might have 3 or 4 businesses with, under 50 employees. You figure you're not susceptible to it, but no, they're going to add all those employees together for compliance purposes. Excuse me, the pay or pay penalty says that if you have 50 or more full-time employees, you have to either provide coverage or you pay a penalty. Now, we're going to talk about the penalty momentarily. But the second part of that is the coverage that you provide, you've got to contribute toward the cost of that, and it's got to be affordable for your employees, or you may be faced with another penalty. Let's talk about the cost of compliance. Use my own company here. We've got 65 full-time employees. 42 of them take our insurance plan. Well, the penalty is $2,000 per employee per year. You get a pass on the first 30 employees. So 65 employees, I get to pass on the first 30 that I don't have to pay the fine on. I got 35 that I'd have to pay the fine on, $2,000 a year, that's $70,000. So next year, if I want to do away with the health insurance plan, I can pay the government $70,000 and be done with all this. My health insurance, just the premium cost this year is about just south of $360,000. And our share of that, the employer share, is $250,000. So I can put $180,000 in the bottom line real quick. Granted, I'm going to have a lot of ticked off employees, but this is a lot of what you hear in the news about, this large company is going to do away with health insurance, that one's going to do away with health insurance. This is what they're talking about. The second part of that is that coverage must be affordable. Again, this is only affecting those with more than 50 full-time equivalents. Providing coverage, you've got to have, if the employee is contributing toward the cost of that insurance, their contribution for themselves and their dependents has to be less than 9.5% of their adjusted gross income. How many know what their employees' adjusted gross income is? How many want to know what their employees' adjusted gross income is?
Yeah.
I mean, that's the thing. Nobody wants to be that involved in their employees' lives. So right now there is a fix in place. They're working on some safe harbor rules that it would just plain be 9.5% of their W-2 income. It makes the compliance a little easier. They also, the IRS recently ruled that a spouse is not a dependent. So this would only apply for employees purchasing employee-only coverage or employee and child or employee children coverage. It will not apply to family coverage or employee and spouse. So that kind of makes the cost of compliance a little more palatable for some mid-sized employers there. The penalty, should an employee leave your plan to go out and purchase health insurance through the exchange if they receive a subsidy because they were being asked to contribute more than 9.5% of their pay to your plan, the penalty is $3,000 for each employee that does that. So, that's another aspect we're really having to be mindful of. What are the employee contributions to the cost of the health insurance plan? Talk about the future of health insurance in Maryland. Maryland's exchange is called the Maryland Health Connection. It's going to be up and running the 4th quarter of this year with plans being ready or being effective January 1 of 2014. It's intended to supplement the existing market, so it's not going to replace anything that's already in existence. One-stop shopping, I'll tell you about how that works, and it'll serve the individual and small group markets. So what we're going to see next year, we're going to have 2 markets side by side. We'll have the existing market, it's not going away, whereby it's served primarily by insurance producers. And you have individual plans, small group, large group plans. Again, pretty much business as usual. Through the exchange, they'll serve individuals. Part of this, part of healthcare reform is an expansion of the Medicaid program. So the Medicaid program is expanding so that those up to 200% of the federal poverty level will be able to get into the Medicaid program. And then we're going to have premium subsidies. Those between 200 and 400% of federal poverty level. Those would all be served through the exchange. Some small employers would have the opportunity to do business with the exchange. Those that qualify for the tax credits, if you want to take advantage of that next year, you must go through the exchange. And finally, the SHOP program, which we'll talk a little bit about shortly. That marketplace is going to be served by insurance producers as well as navigators. Healthcare navigators, this was something set up through healthcare reform. And they're primarily going to be groups out in the community. Many of them that are signing up to be navigators are nonprofit organizations and community health clinics. I'm familiar with the organization that has put in a bid to be the navigator for Frederick County. And their goal, or they're tasked with, going out into the community, doing outreach, telling people about healthcare reform and what's available through the exchange. What opportunities are available to them. Maryland's taken this as taking what they've been calling a no wrong door approach. And this was our recommendation to the state exchange board, is that these individuals have to be trained and they have to be cross-trained. So if they're talking to an individual who does not have health care coverage, they can, through just getting some basic information from them, assess their financial situation and know whether they need to direct them into the Medicaid system, if they direct them into the exchange for subsidized coverage, or if they direct them to the individual market. So that's something that right now we're seeing the state is in the process of contracting with various entities to provide these services. There's going to be extensive training taking place primarily over the summer. And again, the outreach is going to begin in the fourth quarter of this year. Exchange opportunities for small employers. Again, if you're eligible for a tax credit, next year you're going to have to go through the exchange in order to get that. There's also going to be the SHOP program. And this is somewhat unique for small employers, in that you can go to the state exchange and you can give your employees a budget. Let's just say you're going to tell your employees, all right, I'll give you $300 a month to spend in the exchange, and I'm going to purchase you a silver level plan. I'm going to tell you about that momentarily. What that enables your employees to do, some could pick coverage from Care First, some could pick United Healthcare, others could pick Kaiser, and it's all in one program. So historically, small employers have not had the ability to offer coverage from multiple carriers. And depending upon the business, sometimes you get an important employee and they're key to your business, but they've got a relationship with this doctor that only participates with United Healthcare, but you're with Care First because the premium is less. We see those hurdles all the time. That can be overcome going through the exchange next year. They're still right now working in Annapolis to iron out some of this. Our recommendation is to keep it as simple as possible. Occasionally they get all excited and figure you're going to make this wide open where you can kind of go into it as you please, and it just would become too much of a nightmare for you as an employer and plan sponsor, and too difficult for people like myself to try to explain it to your employees. So we're hoping that they'll actually keep things simple in Annapolis this year. The other change that we're going to see in healthcare next year is a focus on actuarial value. Now, we've got their platinum, gold, silver, bronze. These aren't necessarily Olympic medals or anything of that nature. That is the way health insurance plans, especially through the exchange, are going to be designated. And with this new, historically, we've always focused on what's the deductible, what are the co-pays, what are my out-of-pocket expenses or co-insurance. We're going to have a bit of a change where we may still have that, but there's also going to be a focus on what is the actuarial value. And what that means is, in a typical year, for a typical individual, what portion of their health care expenses are paid by the health insurance plan and what came out of their pocket. So if you've got a gold plan, for the average person, that plan should be paying about 80% of their health care costs, and the other 20% came out of their pocket. Now, 80% doesn't necessarily mean that it's an 80-20 plan. I'll give you a quick example. That plan that we have for our employees, it's a high deductible plan. We reimburse them for their deductible, but that annual deductible is $2,000 for an individual, $4,000 for a family. When I run my plan through the actuarial value calculator, it gives us an actuarial value of 77.8%. The state required minimum for these large employers, the federal requirement for these large employers is 60% actuarial value. Well, how high does the deductible and the copays and everything have to be all the way down to the 60% actuarial value? So, it's going to be interesting to see how all this plays out, but you're going to see labels on health insurance plans, especially through the exchange. And the exchange-based products will also be available on the other side in that current market. So we're going to see a bit of a change in what these products look like. So some of the opportunities, again, through healthcare reform, we've got the small business tax credits. The other thing that's going to be available to you next year is just a lot of other resources, or a lot of other avenues for insurance. A lot of times I run into small employers who, it may just be a husband-wife business, but they've been buying coverage in the small group market because someone has a pre-existing condition. Because again, that's one of the rules in small group and pre-existing condition clauses in Maryland. But they're also paying an arm and a leg for their health insurance rate. Next year, what will happen will be to go back into the individual market. So they can look at, where am I going to get the best value? So it's going to open some doors for some people who have historically been stuck. They can also look at whether, am I going to get something better through the exchange or in the traditional market, depending on household income, things of that nature. Of course, challenges brought about through healthcare reform. Again, some of these administrative burdens. That now, if you opt to offer health insurance to your employees, well, you got to worry about things like the W-2 reporting. Again, you're going to be limited to what kind of waiting period you can have for new hires. You got to make certain that you've handed out these summaries of benefits and coverage on a timely basis, that you've addressed all these things. So you're probably taking on a little bit more than maybe you would have in the past. Of course, there's taxes and penalties that would potentially affect some taxpayers and some businesses, and affordability. Sadly, through all of this, the law really doesn't address the cost of health insurance. So, we go through all this, and the accessibility is there, again, like what the state of Maryland has done, but we haven't done anything about keeping plans affordable. Some resources for you. Just because it's on the internet doesn't mean it's true. But there are three, I would say, very good resources. A couple of them are government resources, healthcare.gov. It's got some good up-to-date information. The Kaiser Permanente Foundation, kp.org, also puts a lot of good, great information out on healthcare reform. And then the Maryland Health Connection is Maryland's communication site for keeping people up to date with the state exchange and their progress there. And that's basically about it.